people here today. First of all, I'm going to start with an acknowledgement of country. The Australia-ASEAN Academics Forum, Online Education During COVID-19 and Beyond, acknowledges the traditional owners of the land where this program was developed, the Palawa people of the Lutruwita Nations. We pay respect to the traditional owners and to elders past, present and emerging of the land on which all of the University of Tasmania campuses stand. And on behalf of the University of Australia, we acknowledge all countries participating in this forum and also acknowledge their elders and ancestors and their legacy to us. We acknowledge the traditional owners of the lands where our partners and participants work and live across Australia and Southeast Asia. So once again, welcome everyone. It is lovely to see you all. There are some really fascinating and important conversations and sharing of information going on at this event. It's so exciting. We have two speakers today, but before we introduce those, just some basic housekeeping. We all have Zoom fatigue. We're all tired. So feel free to keep your camera on or off during the seminar. But if you're going to ask a question, we'd ask that you put your camera on so the speaker can see you and engage with you properly. And when you're not speaking or doing a presentation, could you make sure that you're on mute? Because sometimes the background noise disturbs the people talking. I know, I always forget. Usually I'm on mute when I should be speaking. So we have two really interesting presentations today. Lim May is doing a presentation titled Oral Interactive Assessment Involving Persons with Disability. This is really interesting, and I think there are some really good connections to the work that we're doing at the university. So I'm really looking forward to this. So thank you. And our second conversation is going to be with Dr. Malay Zete Sheikh Abdul Hamid from the University of Brunei and Dr. Jaya Priya Kansinathan from the University of Brunei Dar es Salaam. And they're going to be talking about using digital technologies and innovative platforms for learning online during COVID-19 and thinking about them as the new norm for how we work in the future. So we're going to have 25 to 30 minutes for each of the presentations, followed by 10 minutes for questions and answers. And then at the end, we'll come back together and see if there's something we want to say. And we shall then prepare ourselves for tomorrow's really interesting presentations. So Lim, are you ready to go?
Yes, I am.
So let me just introduce you. This is a really fascinating topic. Lim is an occupational therapist in her first life, and her work uses that expertise really brilliantly. She's an associate professor at the Singapore Institute of Technology, and she oversees the Centre for Learning Environment and Assessment Development that looks after faculty development programs in learning and teaching. And this is really interesting work, and looking forward to your presentation very much. So feel free.
Okay, let me just get the view proper subtitled. Hang on. At screen, or is it still on presenter mode?
You are still on presenter mode.
Still on presenter mode. Let's see. I think I need to get rid of them. I can't seem to get the display setting. Hang on.
This happens to me all the time.
Yes, and I was just practicing with it and it all works out well.
I know, you practice it and it's really great, and then you go to do it and the technology goes crazy. You're very calm.
Okay, I got it sorted. All right, I just need to share with you guys.
Perfect.
You see my screen now? Yes? Okay, all right. Let's get started. Hi, my name is May, and I work in the Singapore Institute of Technology. And Singapore Institute of Technology is fairly young. We are the 5th university in Singapore. I am really hoping that when COVID is over, we can welcome you to visit our campus. We are in an old campus right now, but the picture that you see is where we will be in a few years' time in 2024, if all the progressive renovation and everything go ahead as planned. So as introduced, my background is in occupational therapy, but currently I also double head as the director to look after the Teaching and Learning Center in Singapore Institute of Technology. One of the things that in our university we've been trying to drive more is on authentic assessment, because we are particularly interested in applied learning. And with authentic assessment, I think we were making good progress, but obviously when COVID hit, how do you do applied learning? How do you do authentic assessment online? That becomes much more challenging when we are limited to online. So therefore, I'm going to be sharing a little bit about one of the initiatives that I start within the module itself. So today when I'm presenting, I probably will be wearing the hat as a faculty in occupational therapy, not so much of the director of the Teaching and Learning Center, but I'm happy to discuss that later on. Okay. Before that, I'm just going to start with a video, and I hope you can hear the video well. Let's see, let's play.
I'm a quad amputee. I'm a quad amputee. I act as a parent with a young child. My role is to ask students questions about child's development.
Oral interactive assessment is an excellent way to assess both students' knowledge and their ability to articulate reasoning. I'm May, and I teach in the...
I'm a quad amputee. I act as a parent with a young child. My role is to ask students questions about child's development.
Oral interactive assessment is an excellent way to assess both students' knowledge and their ability to articulate reasoning. I'm May, and I teach in the first year occupational therapy program. My students are taught about developmental milestones and what is considered typical development. They are great at answering MCQs and short answers, but when it comes to clinical placements, they cannot converse well with clients who are parents. So, our solution is to change our assessment format from a paper-based one to a 10 minutes online oral interactive assessment. 97% of students surveyed felt that this type of assessment has real-world relevance. We hire and train persons with disability to act as standardized parents. They act as parents with concern and question the students about milestones. The professors then concentrate on listening and assessing the quality of students' answers.
I'm very proud that I can educate our future occupational therapists. This is a valuable work opportunity that is meaningful to students' learning.
Okay. All right. Did you manage to hear the video? Yes? Thumbs up? Yep, great. All right, I will walk through with you what is oral interactive assessment and the context of the module and why we wanted to push for authenticity. We will talk a little bit about how did we go about preparing the students and what we did in terms of preparing and ensuring assessment integrity. Then we'll move on to talking about preparing the actors or the person with disability to do the job, and then about preparing the examiners who are involved. Then finally, I'll walk you through some of the outcomes as a result of this initiative and the debrief that we do with students after the assessment. Okay. A little bit of a background if you are new to the term oral interactive. And oral interactive assessment is an opportunity for genuine and unscripted interaction between students and other students or students and examiner. I think the highlight here is about that genuine and unscripted interaction that we are trying to get to. So specifically, the students demonstrate their knowledge by verbally talking about what's going on in an as authentic as possible setting or what would be encountered at the workplace. It is really not a question and answer test. So not so much of just replicating whatever is going on a traditional exam question and just asking them, but it really should be an exchange that draws upon the students' understanding and create a setting where they can demonstrate and they can apply the course concept. And I think the focus is about the exchange that is going on between the student as well as who's examining them. Okay. It authentic assessment, and it drives at actually assessing competency because it has the opportunity, gives the opportunity for us to develop students' professional skills, enhance their employability prospect. We are able to use oral assessment well and ensure the high standard of assessment, academic integrity. And at the same time, this is an opportunity for them to develop their professional identity, thinking that you have to speak like a professional, act as a professional, and behave like a professional. And one important part is about the ability to help them develop their communication skills. The more relevant the assessment is to the real world scenario, the more likely the students are going to do this well and not want to cheat or engage in academic misconduct. And we'll share more about that in a bit. So first of all, maybe to let you know the context of the module that I taught in. So I teach in a first year module, and this is first year trimester 2. So students have been with us for about 3 months. The module is called Occupational Performance Across Lifespan. And in this module, we are introduced them from cradle to death about babies, about early childhood, about middle childhood, teenagers, adult, and then eventually about old age and dying. In the module, the pedagogy we use is team-based learning approach, which means instead of attending lecture, the student actually have got some pre-recorded lecture they could watch, they have material to read, and when they come into assessment session every week of the session, they are assessed individually first about their understanding of the pre-reading material, and then they are assessed as a group. What we do as the staff is that behind the scene, we are analyzing their results, and then we are kind of giving them that just-in-time mini lecture where we can go into the details of what they've understood or they've not understood. And following this core group experience, then we then break them down into tutorial groups and go into case study and so on. So this is the overall pedagogy behind, but that's not the crutch of the oral interactive assessment. A bit of outline of the topic, as I mentioned. So we go from infant to childhood to dying. And the oral interactive assessment that I'm doing happens at week 8, which means I'm testing them on the material they have understood from week 2 to week 6, all the way from newborn to middle childhood. This is not the first year we are running the assessment. And in fact, last year, we wondered, should we change it or should we just keep going as what we have done previously? So why the desire to change? Previously, when it comes to week 8, what we do is that we give them a paper-based assessment, which means we ask them MCQ question and short answer. We've done it on paper. We've managed to also migrate it into the learning management system and test them online with lockdown browser. But what is troubling me is that I find that students, when they go out on clinical placement, they struggle in terms of articulating their reasoning, which means when they meet a real parent, a real caregiver who is concerned, this student could have scored 80% on the exam, but somehow the words are not coming out of their mouth to explain why is the child behaving this way, what are some things you would recommend to do, and so on. So something is not right there if they can do so well in the MCQ and the paper, but then yet it's not coming out. So perhaps there is really a real need for us to prepare them more and test and give them feedback about how they are articulating the information versus just testing the knowledge, which is what we've been focusing on in the past few years. And I guess the other challenge is how do we do this online because of COVID so that we could actually be very versatile, whether is it face-to-face or online, it can still happen. So how was it done? This is the format, and this was what was explained to students. We use Zoom, and we schedule for them to actually come into sessions by sessions. So each student will be meeting with one standardized patient or standardized parent, we call, which is acted by a person with disability. They will enter a waiting room 10 minutes before when they are going to be assessed, and they will wait to be admitted. We will ensure that their assessment is being recorded so that we could review it, especially when moderating the mark or when giving feedback to the students. When students enter the session, the first thing they do is to introduce themselves professionally to the parents or the actor and check whether the parents can hear them. Then the parents will go about giving some information about his or her child or children and ask some questions. What the student needs to do is to answer one question at a time and within the 10 minutes, cover around that 4 to 5 questions. And after the question is asked, some parents might go into asking for some specific suggestion, or in that exchange, ask for clarification. At the end of this, the parents will thank the student, and that's it. We will transition to the next student. So the prof is behind the scene marking, while the actor is the one who is interacting with the student. This is an example of what assessment looks like. So if I am the actor, I would come in and say, oh, I'm really, really concerned that my 11-month-old baby is crying whenever he sees a stranger. You know, he wasn't like this before. He was really cheerful when he was younger. Is this because of COVID? Is it because we are going out less? Why is he getting less sociable? The student would have to answer that and link it to a developmental milestones relating to stranger anxiety, about their understanding of attachment theory, and why is this considered normal or not. Okay, so the parents might go on to say, oh, what should I be concerned? Can you explain to me what's going on? And then they will move on to the next question to say, well, you know what, he's going to turn 1 soon. What are some milestones I should be looking out for, and what can I do with my child? So this is again a chance for the student to impress the parents or share with some of the understanding of milestone about walking, about fine motor skills, about the toys to introduce and what to look out for. Now, the parents might be asking, oh, I also have an older child who is 3 years old. He tends to be really rough when playing with the baby. Is this normal? Should I be concerned? So now it's a student's time to explain about 3 years old, calibration, how much force do they understand, and so on. So I hope you get the idea. It is about an interaction between a parent and a student, but obviously this parent has been scripted and is acted by a person with disability. And the student's role is to really articulate what they've understood for the past 7 weeks of learning all about the milestone, about developmental theory, in a very real context to answer the concern. And this is really similar to what will be happening in the clinical setting when we actually meet parents who have concern about their children. Let me talk to you about preparing the students. So obviously, this is not the kind of assessment they are used to. They are very used to MCQ, short answer, and so on. How do we go about preparing them? What we did was, the assessment was in week 8, but as soon as week 3, we started preparing them. We shared with them the criteria, we started acting. So myself and one of my colleagues, Li Xiong, we role play so that we could record it. And we role play as an example of a student who's really struggling on giving a very basic answer, almost like one of those conversations you could ask anybody in the bus stop and actually get some advice from any parents kind of answer, versus a professional answer of what a professional will be explaining. And we ask students to critique, to say, where do you think this person is at? Is it at a B or A? What are some of the highlights and so on? And then we break students up into breakout rooms so that they could practice different sessions, different questions with their fellow classmates. And remember, I talked to you about the team-based learning. Every single week, we have tutorial time, and the tutorial is about case study. So during those case study, we always try to find opportunity when student is articulating to tell them, don't just tell me the answer, talk to me as though I'm a parent. So that across the different week 4, week 5, week 6, and so on, they are constantly having the chance to practice talking to someone and explaining. Because you realize it's very easy to write something on a whiteboard or on the big piece of paper and explain your thing in very technical language. But once you try to articulate it out as though you're talking to a parent, that's where they really struggle. But with many practices, it gets better. This is the marking criteria. We give marks relating to the relevance of the response, their ability to respond with a clear perspective, and the answers is supported either by a theoretical concept, research, or issues that are covered in the course. We look for the quality of their suggestions or the activities. When overall, we also look at the ability to communicate, whether is it delivered in an impressive and confident manner, is it targeted at language that is appropriate for the parents, and the pace and volume and so on. It's a wordy slide, don't have to worry about this, but the important message of this slide is to tell you, it's important to let students know where this is going. We let them know how this is scaffolding their learning in the entire 4 years. So we tell them in year 1, you're just answering questions. In year 2, you will be expected to answer, listen in for more things, and trying to explain further and clarify. In year 3, we are expecting you to demonstrate some coaching skills, some counseling skills. So whatever you're doing in year 1 in this assessment is really just the beginning. It will get more complicated as we go, but it is actually linked ultimately to the clinical practice. Next, how do we go about ensuring fairness and assessment integrity? This is very intentional. We cover this in our week 3, talking to the students about it so that they can plan for it. Ultimately, these are year 1 students, so they are still very new, and they are also sussing out like to what extent is cheating taken seriously. First of all, we have planned for multiple scenarios, which means across different days, different time slot, they are going to get different scenarios. Some of them are going to get a 4-year-old child with a 1-year-old brother. Some are 8 years old with a 3-year-old sibling. Some's going to get a twin. So there are multiple scenarios, and if you really choose to tip your friend off, chances is you're going to distract them and actually get something wrong because there's so many different scenarios to pick from. We emphasize to students that we are marking on the quality of the answer, not the length of the answer. We calibrate between the different markers and the different actors, even how they act. And we also review the recording to ensure that in the event things go too quickly, we can double check and actually moderate the answers. We actually also told students about whistleblowing, and that in the event they know that there are a group of students or some students who are plotting to cheat, they can choose to whistleblow and we will protect their anonymity. Of course, we will have to do with the deal with the wrongdoing, and at the same time investigate whether it's true. But I think this is sending down the signal to the student as well that we do not tolerate cheating. And if you know your friend is planning to do that, we will protect you if you actually come and tell us. Importantly, I think the year 1 students, especially being young and innocent, sometimes they are overly helpful. So we tell them, what does integrity mean to you? It means supporting each other by practicing, by giving feedback, by revising. But when you share the test question with someone else, this is not real help. And please do not put your friend in difficult position by asking, oh, do you have any tip for me? How did it go? Anything to help me focus on my study? Because then you're kind of really testing your friend on how much they are willing to share with you. If you are a real friend, don't put your friend in those difficult situations. So we have conversation about this in order to really drive home why is it important to practice with integrity, especially if the ultimate aim is for you to be trained as a professional, to be as professional as can be. We also tell them the option of reassessment, not options, but actually the reassessment practice, that if we suspect them of cheating, we can go and try another round of assessment, and this time face-to-face with the examiner. So example will be if they appear to be reading out from the screen or trying to type to find the answer, or they seem that you have really memorized the thing that said exactly the same of the friends. These are examples where we won't just say that you get 0 or you fail, but what we'll do is that we will pick another situation on the spot and give them a longer assessment face-to-face. So many students really doesn't want this to happen. So when they know this, they are also extremely careful. This is also possible because in the event there is a technical glitch, a little bit like what happened just now, no? I've wasted 3 minutes of the presentation time. And if this is going to be disadvantaging student, we want to tell them that we will give them a reassessment in the case this takes place. Okay. A little bit about preparing our actors. We saw this as an opportunity to introduce work to person with disability. As you know, with the COVID, a lot of jobs got disrupted. It's actually really hard to find jobs. There are so many unemployed people, especially for a person with disability to be looking for a job opportunity is extremely hard. It's made harder because of the economy situation. So if we decide to actually work with a person with disability, importantly, we need to know their disability and their activity tolerance, whether are they able to sit the whole day for this, are they able to read, are they able to articulate, and we need to test it out. We have dry run with them. We also prepare them by telling them and sharing with them what they can't or cannot repeat and what kind of some prompts that are appropriate. Because sometimes they want to be overly helpful to the students because they say, poor thing, they look like really stressed, can I help them out? So we have to really be strict to say we cannot be not fair to certain students. And we give feedback to them during the acting in order to make sure things are aligned. Something about preparing our examiner. we have two examiners this time around, and we'll have more in the future, is getting to know the actors, giving samples of the oral assessment beforehand so that we could grade. And after that, we talk about the moderation and the discussion of expectation and getting familiar with the technology. Here are some outcomes. Okay, so the first one say, the type of assessment enables me to gain professional skills. As you can see, quite a big majority felt that it's definitely true. And some of them actually think that it's a little bit contrived, but these are the minority. The second question, this assessment enabled me to gain professional skills. The third one, which is a score really high, this type of assessment has real world relevance. This is an interesting one. We asked them after the oral interactive, do you feel more confident, same confident, or less confident about their ability to explain their point of view across? Interestingly, some students with a lot of practice, they feel more confident, some remain the same, but the one with less confident are also the one probably that they have done so much work in writing it down and they haven't practiced, and having the chance to do it with the parents, they realize that it's really not as easy as I imagine it to be, especially with the performance anxiety coming in. We asked them, comparing to your anxiety with doing oral interactive versus other kind of assessment, are you less anxious, equally anxious, or more anxious? As you can see, it is 10 minutes, but actually majority of students are more anxious. It's something that we haven't trained our students well for, because I guess with the first 17 years of education, it has been a lot of writing, and when it comes to presentation, it's often PowerPoint that you can script and memorize, whereas this is an exchange, which is not a kind of typical assessment that they are used to. When it comes to assessment grade, it's really quite interesting to see how diverse it is. We have a handful of students who got A plus, like 5 of them, and 9 got A, all the way to 3 with F and 5 with E. You can see how it really spread out and differentiate the students with different ability. Some of the feedback as well, we asked students, what did you do in order to prepare for this? Some students say, I took a lot of time to translate intuitive knowledge into verbal explanation. And the other one say, I try to remember milestones of different age group and try to relate to people around me. Some were practicing with their mother, some were practicing with their friends. Some students talk about drawing mind maps to link up the different stages of growth and discuss with their classmates to practice oral question. Another one talk about collaboration with friends to compile information into a spreadsheet and to visualize all the milestones. On Monday, one of the sessions I attended, we were talking about how do we build connectivity between students? How do we actually support students with peer learning? I think assessment provides that opportunity. When we give an assessment like this, to say that there's no way you can just memorize it and keep looking at your textbook and screen, you need to practice. This assessment provided that context for them to link up with another peer, to test each other, to give each other's feedback. So I think we can be quite clever and intentional in terms of using assessment and using those formative feedback as a chance for them to learn from peers. What happens after? So we do debrief to the students because it's important for them to learn. You highlight what was done well. We went through the range of acceptable answer. We also got the permission of students who have gone A and show them this is what we mean by really good answer. And after watching 1 or 2, they were, wow, this is impressive. They could really see example of what is it like to do it really well. And of course, we will have a whole range of students who were disappointed. They put in so much effort, but they didn't get the A that they wanted. What do we do with them? Some of them will email me and say, oh, I'm really disappointed with my grade. I don't know what I can do. And I'm always very clear that I'm not talking about remarking here, because I would have watched their clip and I would have watched it with someone else and decide on the marks. But what we'll do is we'll visit their video clip again. And I will use that coaching approach where I will pause. Instead of telling them the right answer, I would ask them, now, how would you have answered this question, assuming you're doing it for the second time? And they would try it. And they were like, no, that's not good enough. Give me a different try. And we will talk about expectation. What does A and B or C means to you? So that it is not so much of just trying to repeat the right answer, but really getting them to watch. And many of the time when they watch those recordings, it's very enlightening for them to see why were they so deserving of a C versus a B or an A? And what else could they work on? And we kind of debrief about, is it the anxiety? Is it your knowledge? Or is it lack of practice? And they were able to tell, to say, I think I've been writing too much, but I didn't talk enough. So I need to work on that in the future. I think this is an important part of the feedback loop, from preparation to the end, where they actually understand where they were going wrong and what else can be done. Let me summarize some of the learning points. First of all, I feel that the preparing and the practicing of students is important, particularly in such an anxiety-provoking assessment, to not just throw them and surprise them within week 8, but to early preparation along the way. I am very happy that this has provided an opportunity for persons with disability to work from home and to actually contribute meaningful work. And I'll share with you in the next slide that this is not the only assessment. We have other opportunities that we've been getting them involved. I think oral interactive assessment assess far more than knowledge, but also the skills in articulating, in justifying, in defending. We are only doing it in a very basic way. In year 3, if we are really getting them to do coaching, we will be getting them to even listening in and asking the right question. So more to come for the students. And in terms of time, many people are saying that, oh, we don't have time to do this. It sounds a terrible amount of work. But to be honest, it is 2 full days of marking, maybe half a day of watching some of the things that we wrote down. It is unusual. This is far better than having 1 whole week of marking essays, of marking short answers and so on. So in terms of time effectiveness wise, if you actually plan for 2 or 3 days or whatever, depending on your class size on it, it is far more effective than doing lots and lots of marking. And I think it's something that the student enjoy, we enjoy, and the actors as well could see their part they play in making this enjoyable and meaningful. We do other work with persons with disability. We hire them as community teachers to teach our students in the community how they take train, how they go to the supermarket. Our persons with disability are partners to train for communication skills, to test our students, like asking them questions in very broken English, in dialects, to see how the students react. And they are also helping us in the standardized assessment. So this is not the only chance, but there is a range of opportunity where we could work with quite a number of different persons with disability. And that's it. I would really love to hear some questions, suggestions.